We're all hearing that the COVID-19 vaccine is safe, but how effective is it for MPN patients?
Well, I believe that this is one of the most important issues of our time. I think the way I would approach the COVID-19 question is, one is we know that if our patients contract the virus, that can be deadly in actually many of our patients. So I think it's actually important to remember that the virus is still out there and that getting the virus is potentially very life-threatening, not only for the general population, but for our patients. For the vaccines, I kind of have two stories to tell you. So one is my own anecdotal experience in the clinic, where it has been surprisingly and remarkably well tolerated in most of our patients. This is both the mRNA vaccines and as well as the J&J vaccine. And so overall, we've seen a very minimal amount of allergic or other reactions. I think the most important part, as you said at the top, is, for specific medical advice, we need to be talking to our own providers. But I think for our MPN patients, we're giving some caution, looking at the blood counts, what chemotherapy folks are on. But in general, I've been happy with that rollout. Now, for the effectiveness of them, sure, that's a question of ongoing research. There are some data that's coming out, particularly in CLL and other leukemias, that maybe some of our immunocompromised patients, as you would expect, may not be able to mount the appropriate response, but all that data is moving and fluid, so we'll see. And then I think the other point here is, with this question of the virus itself and maybe some of these vaccines having a signal for increased blood clots or coagulopathy, this is something I think we have to follow in our MPN community, only because, our patients are already at a higher risk for both bleeding and clotting. So the virus itself, COVID-19, post-COVID syndrome, coagulopathy, possible side effects, idiosyncratic and rare for sure from these vaccines that can lead to a vaccine-induced thrombotic state. I think these are some of the factors that we have to watch out for. So in general, we don't yet know the exact answer for each patient, PV, ET, MF, how effective the vaccine may be, but we are encouraging everyone to go for it unless there's an obvious contraindication.